My name is Guy Salama, and I'm a professor of medicine at the University of Pittsburgh. And I've just had the pleasure of presenting my work on RELAXIN as a potential therapy for atrial fibrillation at the International Academy of Cardiology, the 20th World Congress on Heart Disease. The general topic is how to suppress atrial fibrillation, which is now a pandemic in the human population, with 142 million people expected to have this malady throughout the world. And as the population ages more and more, it becomes a really serious public health problem. RELAXIN is a hormone of reproduction that has been discovered for many decades. To be precise, in 1926 it was first identified as a peptide that produces relaxation of ligaments in mammals. As a hormone of reproduction, it is measured and found in the serum of pregnant mammals. It rises during pregnancy and throughout the gestation period, and then plummets after parturition. More and more, it is now implicated as a therapy for cardiovascular diseases. The first inkling was that it has an effect on systemic arterial compliance, and by increasing compliance, had the potential to improve dyspnea in patients with heart failure. The clinical trials ran by Novartis had an endpoint of reduced dyspnea after treating patients with RELAXIN for 2 days IV. The effects on dyspnea were there, but they were not so dramatic as what was found subsequent to that, as an improvement in mortality of 37% within 180 days. And this has, of course, engendered a great deal of interest, declared this as a breakthrough therapy by the FDA, and further clinical trials are now underway with mortality as an endpoint. In animal studies, what we are now showing is that RELAXIN suppresses atrial fibrillation in 2 models of AF. The first one is spontaneously hypertensive rats, where they have easily induced atrial fibrillation with a single premature pulse. These arrhythmias are sustained and will not spontaneously self-terminate unless interrupted by the scientist or the physiologist. We find that the effects of RELAXIN are multifaceted. It has effects on the extracellular matrix and causes extracellular remodeling through a decrease in fibrosis, reversing fibrosis, not merely stopping fibrosis, reversing it back to control levels. It also has effects on electrical remodeling by increasing the sodium current and increasing conduction velocity. Conduction velocity of premature pulses become as fast as those taken during normal conduction velocity at low rates. And as a result, a premature pulse encounters non-excitable tissue and arrhythmias are not possible. We cannot even get AF by burst pacing. The second model we tested was that of the 2-year-old rat. This is a geriatric model of old age. In this context, these animals spontaneously perish. We lose about 10% spontaneously. They have spontaneous arrhythmias, but for experimental purposes, we trigger the arrhythmia with a premature pulse. Again, if you treat these animals for 2 weeks with RELAXIN at 400 microgram per kilo, you suppress arrhythmias, and it is no longer possible to obtain AF in these animals. Conduction velocity plays a big role in terms of protecting these hearts from atrial fibrillation, and we also see the same effects in terms of extracellular matrix, reduction of fibrosis. In the context of electrical remodeling, we're only touching the tip of the iceberg. A great deal needs to be done to look at the effects on calcium current, potassium currents, on the effects on fibroblasts directly and their transformation to myofibroblasts. And RELAXIN appears to act at all these multiple levels. Indeed, it does deserve the name of a pleiotropic hormone.